Uh-oh, that snack might be biting you back. Hi, my name is Dr. Jeff from Bella Dental, Penrith's most award-winning dental practice. Today I wanted to share with you kind of like dental school 101 and how tooth decay works. Nowadays, the way that we eat as a society is very different from 50 years ago. There's a lot more snacking. There's a lot more pre-packaged foods where we're just constantly grazing throughout the day. This has an impact on our teeth, and I'll explain below. Now, for tooth decay to happen, there are three factors that come together to form the disease. All right. So the first factor is acid exposure. Every time we eat, the sugars get converted into some sort of acid from the bacteria that's in our mouth. If we had 3 square meals a day, no problem. The problem is the constant snacking. And each time you snack, there's acid exposure, acid exposure, acid exposure. This is made worse for people that are on a whole bunch of medications, who tend to be a bit older or the depressed sort. I'm not going to get much into that, but just know that the more medication that you take, the more acidic everything gets. And if the mouth is exposed to acid over a long period, that's what leads to tooth decay. The second part of the equation are vulnerable sites. Now, what this means on a tooth is that if we were to take a normal tooth, you're looking down on it like this, you'll see that there are fissures. I'm going to just show you what vulnerable sites are. The first type of vulnerable site lies in the fissures, right? If I was to get a ninja sword and slice it along like that, now we can see that here's what we see, and that part which corresponds with the fissure is actually like this little deep little crevice that is very difficult to keep clean. The more acid that goes into there, the deeper the decay gets until it hits that nerve. Ouch. The other area that gets a lot of acid exposure would be between the teeth. We brush quite well on the smooth surfaces, but how many people are actually flossing? Like, come on, really? If you're one of our patients that has been seeing our perio program or our hygiene program over the long term and you do floss, awesome. Everybody else, come on, let's get that floss back out. Here's what actually happens when we don't floss. When we brush our teeth, we get rid of most of the plaque on the smooth surfaces. The plaque still gets stuck in between. This leads to tooth decay in between the teeth. And then for us to be able to get to that decay, we have to drill through the top of the tooth to access all the rot that's in there and then fill it with some sort of filling material. This is absolutely preventable with flossing and a bit of guidance from the dentist. Lastly, the last area that is a high-risk site would be along the gum line. Now, this is especially so for people that have high acidic diets, people that are drinking V, Red Bull, gamers, and meth heads, right? Because instead of drinking water, they're on the V, the Red Bull. A lot of them are drinking Mountain Dew over in the United States. And as a result, or Coca-Cola, as a result, this area gets quite sore. It doesn't get brushed, if they even brush at all, and it results in decay along the gum line. This is really, really hard to fix, and eventually it means tooth loss over the long term. All right. Oh, I forgot. The last part of this was time. The more exposure there is to acid, if all these are come together, it means the teeth collapse with big holes, which results in either pain, tooth loss, or a big expensive dental bill to save these teeth. Now, as we know, dental disease is completely preventable with a few good habits at home, some instruction, and some guidance from the dentist. Hey, if you got any questions about this, we're more than happy to help. 4722-6300 is the number to call. And please, if you're experiencing some sort of dental emergency, call as soon as possible. We look forward to meeting you in the future and hope you've had a great day. See ya.